Good day, everyone. I am Junalan Ihamon, a second-year student of Nurses Campus, and today I will be going to discuss to you the typology of learners with special needs, specifically learners with socio emotional disorders, namely depression and obsessive compulsive disorder. But before we go to the main topic, let us first know the objectives that will be obtained at the end of this lesson. First, define socio-emotional disorder and its types. Second, identify the causes and effects of these socio-emotional disorders. And third, evaluate different strategies and different aspects of special education. Most people can recall a time when they made an unfounded assumption about how someone with a disability would act, only to discover later that their assumptions were not entirely correct. No matter who we are dealing with, our expectations about people are sometimes realized, and other times we are surprised to discover how different an individual is from the stereotype on which our expectations were based. Socio-emotional disorder includes illness or disease that affects a student's thoughts, processes, perception of reality or judgment, which results in disturbed behavior. This disability may be temporary or permanent. An emotional disorder affects a person's ability to be happy, control their emotions, and pay attention in school. According to Gallaudet University, symptoms might include inappropriate actions or emotions under normal circumstances, learning difficulties that are not caused by another health factor, difficulty with interpersonal relationships, including relationships with teachers and peers, a general feeling of unhappiness or depression, and feeling of fear and anxiety related to personal or school matters. Actually, there are 4 types of learners with socio-emotional disorder, but today we will be going to focus on depression and obsessive-compulsive disorder. I know you are very familiar with the word depression, especially on teenagers. So depression is a major depressive disorder, a common and serious medical illness that negatively affects how you feel and the way you think and how you act. Children may become sad, tired, bored, or seem to be having a bad day from time to time. Usually, when the child becomes engaged in an activity, the feelings seem to pass in a short period of time. However, when these feelings persist and keep the child from going about his or her regular day, clinical depression may be the cause of the moodiness. Depression is said by the Federal Center for Mental Health Services to present in about 1 in every 33 children. That figure would mean that about every classroom of children would have 1 child that is clinically depressed. The leading causes of depression are lack of sleep, poor eating habits, and not enough exercise, which are the recipe for depression among students. The stress that comes with the academia, including financial worries and pressure to get a good job after school. And another is academic workloads and lack of engagement in social activities. Depression can lead to a low achievement, social isolation, and problems getting along with friends and families. Depressed children can take their own lives too, which is very scary. Once the child has a serious period of time with clinical depression, the child is at risk for serious depression again over the next year. When the students have depression that goes unnoticed, their mental health is at risk, which can lead to social and behavioral problems, poor performance and learning, neglected hygiene, poor self-care practices, and low self-esteem. Long-term depression can result in very poor self-concept, but it is treatable. Play therapy has been found in 8 of 9 studies to be show significant improvement. In some cases, pediatrician may prescribe medication and support therapy. Play therapy is one form of support therapy that has been used to treat depression. Here are the 6 ways to help students with depression. First, develop a working and collaborative relationship with the student. Second, avoid negative techniques. Third, make an adjustments or accommodations in assignments or tasks. Fourth, plan for success. Fifth, consult with your school psychologist, school counselor, or school social worker. And 6, get a mental health certification to learn current best practices. understanding, patience, compassion, knowledge of the nature and cause of depression, a desire to help, and a commitment to improve outcomes can be major factors in helping students with depression to succeed in school and in life. Teachers can take steps in the classroom to help recognize mental health issues to their students. Now, why should we care about depression? As a student and as a future educator, emotional and mental health is very important because it is a vital part of our life and impacts the thoughts, behaviors, and emotions. Being healthy emotionally can promote productivity and effectiveness in school activities. Another type of socio emotional disorder is what we call obsessive compulsive disorder. Obsessive compulsive disorder, or OCD, is a disorder in which people have recurring unwanted thoughts, ideas or sensations or obsessions that make them feel driven to do something repetitively or compulsions. The repetitive behaviors, such as checking on things or cleaning, can significantly interfere with a person's daily activities and social interactions. According to Mayo Clinic, OCD is characterized by fears and irrational thoughts that lead to obsessions, which in turn cause compulsions. If you have OCD, you engage in compulsive, repetitive behavior despite realizing the negative consequences of, or even the unreasonable nature of your actions. If you or your loved one is experiencing any of these behavioral disorders, it is important to get help as soon as possible because these conditions can affect quality of life to such a degree that they may lead to self-harm. I have here some causes of this disorder. So first, genetic. Second is stress. Third, life-changing events. Fourth, changes in brain or imbalance of serotonin in brain. Fifth is personality or perfectionists or neat freaks. And sixth is the thinking mode or overthinkers. OCD is like an unwelcome guest with bad manners. It moves into a mind and it doesn't want to live. Students with OCD may appear to be daydreaming, distracted, disinterested, or even lazy. They may seem unfocused and unable to concentrate, but are really very busy focusing on their nagging urges or confusing, stressful, and sometimes terrifying OCD thoughts and images. They may also be focused on completing rituals, either overtly or covertly, to relieve their distress. It is not always easy for teachers to recognize OCD in the classroom. Students may keep their worries and concerns to themselves. They may try to do rituals in ways that others won't notice, but teachers may notice that a student seems stressed, anxious, or preoccupied, or they may notice behaviors that could be signs of OCD rituals. At school, students with OCD may ask the same questions many times or ask for reassurance. Erase, rewrite, redo schoolwork or test. Reread materials or start over many times. Have trouble reading aloud. Skip items on tests or homework. Have trouble making choices. Or often say, I don't know, and take a long time to complete a work. As a future educator, depending on students' age and needs, and whether or not I know a student who has a diagnosis of OCD, I should consider these ideas that if I have noticed possible ritual behaviors that seem to impact a student's schoolwork, I should talk privately with the student in a supportive way and share what I have noticed. Have students work with peers to complete a specific task and give extra help to get work completed, or talk with students' parent to learn more about the student. Share what you've noticed and ask how you can best respond to a student's rituals that might happen at school or in class. But to some students with OCD, they usually need to work with therapists for a few months or longer and take medicines to help manage anxiety. Through the identification and explanation of the different types of learners with special needs, we are able to learn how to deal with them, not violating any rights and our rights as well. And as a future educator, I am obliged to know and create different strategies that will help in handling my students. And it is our responsibility to know students in order for us to deal with them. By giving importance to these concepts, it allows students to also enjoy education and gain confidence due to learning differences. Thank you, and I hope you learned something. Bye!